Let's begin with the study of sternal angle. It is also called angle of Lewis. Okay. Think of your chest like a strong box made of bones that protects your heart and lungs. In the middle of your chest is a long flat bone called the sternum. We also call it breastbone. The sternum has upper part and middle long part. Upper part we call it manubrium and middle long part we call it body of sternum. Where these two meet, a small bump is formed. That bump is called the angle of Lewis or sternal angle. Imagine it like this. Your sternum is like a two Lego blocks joined together. At the joining point, there is a tiny blade or angle. That angle is sternal angle. Let's see the introduction. What we have written in our notes. It is a bony angulation formed at the junction of manubrium and body of sternum. So the simple meaning of it is bony angulation means a little blend in bone and junction means meeting point. So the sternal angle is the small bump formed where the upper and middle parts of the sternum join. Now the situation. It is situated 5 centimeters below the suprasternal notch. First understand what is suprasternal notch. It is a small hollow deep at the base of your neck. You can touch it yourself. Okay. So the 5 centimeter below suprasternal notch there is sternal angle. So the sternal angle is about 5 centimeter below that neck. Okay, that is a hollow. Now let's see the events at the sternal angle. Why studying of it is very important. Let's see it. Okay, this is most important part. Doctors love this area because many body structures are at the same level here. Think of it like a busy traffic crossing inside the chest. What we have written first sentence? A plane separating superior and inferior mediastinum. Mediastinum is the space between the two lungs. It contains heart, trachea, food pipe, big blood vessels. Okay, so we have divided it into two parts, upper part and lower part. Upper part we have already studied mediastinum. We call it superior mediastinum and lower part we call it inferior mediastinum. Inferior mediastinum is again divided into three parts, anterior, middle and posterior. Now we will not go it in detail because our topic is sternal angle. So the sternal angle is like a divider line between upper and lower chest compartments. Second is formation of cardiac plexus. Okay, a network of nerves for the heart. It is like a telephone wires controlling the heart. At this level, these nerve fibers join together. So we said that formation of cardiac plexus takes place. Then upper limit of the base of heart. Okay, base of heart, you have already seen it. Where is it exactly? The broad upper back part of the heart is the base of heart. Okay, the top border of this area lies around the sternal angle. Now let's see. Ascending aorta ends and arch of aorta begins. So the aorta is the biggest artery. We have already studied the blood part, heart, then ascending aorta, then arch of aorta, then descending aorta. Okay, so at the sternal angle, the ascending aorta finishes and the arch of aorta begins. Next point is that arch of aorta ends and descending aorta begins. Okay, the arch curves like a candy cane. After curving, it goes downward, becoming the descending aorta. This change also happens around the sternal angle level. Pulmonary trunk divides into two pulmonary arteries. Okay, pulmonary trunk means what? It's a big blood vessel carrying blood from heart to lungs. At this level, it splits into right pulmonary artery and left pulmonary artery, like a road dividing into two roads. So, pulmonary trunk divides into two pulmonary arteries. Trachea divides into two principal bronchi or bronchi, but you call it bronchi. Okay. So, trachea is nothing but a windpipe carrying air. At the sternal angle, the trachea divides into right main bronchus and left main bronchus. This division is called carina. Okay, like a one tree trunk splitting into two branches. So it is very important, trachea divides into two principal bronchi. Our next point is azygos vein opens into superior vena cava. Azygos vein is a vein draining chest wall blood, right? It bends and joins the superior vena cava. Okay, the superior vena cava carries blood to the heart. This joining happens near the sternal angle. Now the thoracic duct crosses from right to left. Thoracic duct is the main lymph drainage tube of the body. Okay, it carries lymph fluid. At the sternal angle level, it moves from right side to left side, like crossing a road. So we have included this point that thoracic duct crosses from right to left. Now let's see its applied importance. Important landmark for counting ribs. Okay, this is very important clinically. Second rib attaches near the sternal angle. We find the sternal angle first, then count ribs downward. Okay, it is used for listening to heart sounds, checking lungs, giving injections, finding intercostal spaces. That's why sternal angle and angle of fluid is a very important topic. Now let's revise once again. Okay, at the sternal angle, air pipe divides, blood vessels change direction, nerves gather, lymph duct crosses, and we count ribs. So, the sternal angle is a small bump where two parts of the sternum meet and many important chest structures are found at the same horizontal level. So, it is very important.